If you're someone who suffered a sprain or strain of your fingers, whether it be your big knuckles or your middle knuckles, maybe you did something, you twisted it, and now it hurts. What happens if you like completely ignore it and don't treat it? Well, my name is Huang. I'm an occupational therapist and certified hand therapist. And I'm going to share with you, what happens if you leave it untreated. Because sometimes people think, oh, because it's not broken, I don't have to do anything, right? Or I can just go ahead and just tape it up myself. Sometimes that is possible. It really depends on the severity of a sprained finger. Now, I bring it up because I just had someone come into the office. She sprained her fingers. She actually sprained two of them because something was falling on top of her and she wanted to catch herself, and it was heavy enough that kind of pulled these knuckles back. And it could be that she sprained, you could sometimes sprain these big knuckles, right, your MP knuckles, or most likely she sprained her PIP knuckles, the middle knuckles. And I have freakish fingers, so I can show you, like, if you sprain those knuckles and they got pulled back beyond where they're supposed to go, that is, a sprain. Just like if you twisted your ankle, that's the same thing as a sprained fingers. Like, it got twisted, it got pulled on too much. And honestly, those are the worst hand injuries, or it can be some of the worst long lingering hand injuries. And it's because most people think, well, if I sprained it, I'll just ice it, I'll just rest it, I won't move it, and will get better. Now, you might be able to do that with your knee or with your toe, but honestly, if you leave your sprained fingers untreated, they can become really stiff and they become really painful. And when your fingers get real painful and stiff, what happens over time is, because you're not using your hand correctly, you'll develop various types of tendonitis, whether it be wrist pain or elbow pain. It becomes a whole hot mess. So, what do you need to do? Well, one of the things that you can do is go make sure you find a trusted occupational therapist or certified hand therapist who can really help you decide what you can do based on your fingers at the time you're going to find that trusted hand therapist. Most people come to us around 3 to 4 weeks, which is a little bit on the late side, but that's okay. Nothing wrong with it. Let me tell you what could happen if you just sprained it. Sometimes people go and they buy those aluminum sticks that you can find at the not grocery store, drugstore, and just tape their arms up. If you go to the urgent care center or sometimes the doctor's office, they'll do the same thing. However, here is the kicker. They're important for a very short period of time, about 2 weeks, okay? And it's important which knuckle you sprained. If it's this knuckle, right, your middle knuckle, you want to immobilize it, rest it for about 2 weeks, and then you want to start to gently move it. And that's because the ligaments of your knuckle, my handy dandy drawing, this is what I do with my students, right? We have what's called collateral ligaments, right? These are the ligaments on the sides of your fingers. You have one on one side and one on the other side, and they're like parentheses, and they hold your joint together, and it prevents it from going side to side. So if you make your finger straight and you push it to one side and push it to the other side, if it hurts, you might have sprained it, right? So those ligaments are tight all the time. They're tight when you make a fist, they're tight when you open. So shit's just gonna fucking hurt all the time. Excuse my language, but they hurt, and you want to curse somebody out because they hurt that bad. So they don't like to be immobilized too long. When you immobilize them too long, what happens is they get really, really stiff. And they'll get stiff in most of the time in a bent position, in this angled position. And then it's really hard to get it straight, and then it's really hard to bend it. So it gets stuck right in the middle. So if they're sprained, don't leave it untreated. Don't leave it immobilized too long. Sometimes they send, you go to the urgent care, or they go to the doctor and they send you to therapy, or they send you to the doctor, and you're like, well, it hurts so much, I don't want to go do anything. Please go somewhere, find a trusted occupational therapist or a certified hand therapist, and they're going to help you either get into a better splint or help you get moving and using a different splint. You don't want to immobilize everything, because when you immobilize everything, it's going to cause more harm than good. Okay. So 2 weeks tops, 2 weeks tops. And then you don't want to go ham. I know the idea of no pain, no gain. Hand therapy's got to hurt. That does not apply when you're talking about a strain or a sprain of the ligaments of your fingers. Um, if it hurts a lot, you're gonna like your body, okay? Your body's really smart. It's not going to let you move it, right? So there's ways in which to move and to work the hand so that it can be gentle, so it can be relatively pain-free, so that you have an opportunity to move it better, faster, so you don't develop other issues. So don't just start jamming it down. It's gonna hurt. One of the things that I recommend when you first sprain it and you start to gently move it, one of the first things you can do is actually just massage the sides. Sometimes I see people massaging the palm or the back, but we have a lot of structures, a lot of ligaments, and actually our muscles come up the sides. They're very, very thin and small, but they need a little love and tender care as well. So definitely you can massage it on the sides. Sometimes you can go up, sometimes you can go down, which one feels better. And then, of course, you can do it on the side. One of the most important things you can do is to gently stretch it, right? So I'm just pulling it apart just a little bit and making it go straight, right? So don't be aggressive. Sprains and strains don't like you to be aggressive. So you want to go nice and gentle and stretch it straight. And then, they tend to be very swollen. So what you want to do is you can massage either the skin and the tendons coming up, or you can massage it coming down. Which direction feels the best for you? And that's the direction you're going to move in, because no matter what direction you're moving in, you're going to be moving some of the tissue to like loosen it up, soften it up, and allow you to move a little bit better, right? But at the very beginning, please go gentle. And if it's not working, or you're not really sure how hard or how aggressive or how you should be progressing, every sprained finger I've seen is different. So go find yourself a trusted occupational therapist or certified hand therapist that can guide you in terms of how to progress it, because you do want to see some progress every week, right? And there are specific ways to see it, that it's progressing in the timely manner, because you want every week to be able to do a little bit more and a little bit more, right? So massage it in one direction or the other direction to loosen it up, and don't forget to massage on the sides. Now, if you don't treat it, it's going to get stuck, right? And once this knuckle gets stuck, it's going to mess up this knuckle, and it's going to mess up this knuckle. And a lot of times it can mess up the adjacent fingers, right? The ones next door. Now, if you sprain or strain your big knuckles, those take a little bit longer. So we have collateral ligaments. There are these parentheses on the sides of these knuckles too. But the great thing about our big knuckles is it allows us to bend, extend, and open and close. And so those parentheses, those ligaments there, it's a little complex. I'm not going to go into the whole anatomy of it, but it has a lot of movement, and it gets tight in one direction or loose in another direction. So these ligaments need to hold and give you more stability in your hand so it doesn't hurt. And these, if they're sprained, need more time immobilized, but you don't have to immobilize everything. You just want to immobilize this one joint. And there's specific splints for it. It's called I create them ourselves. We make custom fitted splints or orthoses so that we can put it in a way that fits your hand, so it will stop this from moving. But you don't want it to be too straight, but you don't want it to bend. So you need to be like, just like Goldilocks, you want to be right in the middle, just right. And then you have to let this knuckle and this knuckle free. Otherwise, you're going to mess up your whole hand if you stop too many joints from moving. Let me know if that makes sense. You can leave some comments below if you need. I sprained this knuckle once. It was it was like a grocery bag, and I put it down, and my finger got caught on the handle, and because it was heavy, it pulled. And because it pulled, you see how it's pulling it? So it stressed these ligaments on the side. I cannot tell you, my hand was hurting for weeks. And it was a mild sprain. So I can't even imagine if you have an injury like this and it's a little heavier, how painful it can be. So sometimes just blocking this, just protecting this joint for a little bit of time can help prevent continued pain, can help prevent you potentially going in for surgery or something like that. I actually had a student of mine who sprained her finger, and they did an MRI. You can't always really see, these structures are so small. And the doctor was like, yeah, it's probably, because they tested, they push on it, and they're like, yeah, it's probably strained, it's probably torn. And they put her in a buddy strap. And the thing is, the buddy strap just buddies this one to this one, but it allows too much motion. And so in my class, I was like, hey, if that's not working for you, I need you to put you in this type of splint to stop this from moving, get it stiff a little bit, and I need you to wear it for 4 weeks. So unlike this middle knuckle, we were wearing it for 2 weeks. For these big knuckles, we actually need more time. So patience is key for when you sprain these ankles. Don't leave it untreated. It can cause tons of different problems in your hands. So, but just know that when you sprain or strain something, it is a ligament issue, and each ligament in our joints are different, and they need different, love and attention, and they need different time frame to help it heal better. So you want to stiffen it up a little bit, so that it can like scar down and not be so painful. And then after that, there's specific ways to move. But these need a little extra time, so about 4 weeks, sometimes a little bit longer, depending on how severe it is. So please don't leave your sprained fingers untreated. As an occupational therapist and certified hand therapist, I tend to see them untreated because by the time people come to me, they have left it for weeks, months, and sometimes even years. And then they wonder what can be done. And every case is so different that I just can't, it's not a cookie cutter, because even though we use our hands for everything, all of our jobs are a little bit different. So it's different. I can't give like this is what happens. But there's consequences to not taking care of something, especially at the beginning. Obviously, when you take care of something at the beginning, it's much easier, right? It's kind of like a roof leak. You take care of it when it's like drip drop, real small. It's gonna be a little bit of time. It's gonna be a little expense. You ignore it, and the drip becomes bigger. It ruins all your drywall. It's a hot mess. Now you got to replace everything. So it's kind of like that with your hands. So please, from a certified hand therapist here, please don't leave them untreated. If it's been going on for at least 3 or 4 weeks and you still don't see results, right? You don't see it better, please find a certified hand therapist, occupational therapist in your local area that give you some clarity, some advice in terms of what is possible for you. All right. My name is Huang Tran. I'm an occupational therapist and certified hand therapist. You're seeing me here in my clinic at Hands On Therapy Services in Miami. I hope this video helped you. And if it did, hit the subscribe button so you can follow for more videos like this. If you have a comment, leave me a question or comment below, because your questions and your comments can help me to make more videos just like this one. All right, peace out. Thanks for tuning in, and I'll see you next time. Thanks.